The only workers allowed to unionize at the VA now are cops. Imagine that. Doctors and nurses are being pushed out of healthcare. And when the VA can't treat veterans, those patients end up in your hospital, clogging your ER, driving up your wait times. I'm Tom Smoot, your favorite biomedical engineer and former special operations soldier. The VA just lost 40% of the doctors they tried to hire because the admin wants the VA to fail. Here's what they're not telling you. Almost 40% of the doctors the VA offered jobs to this year turned them down, 4 times higher than last year. Not because they don't want to treat veterans, but because they can see the whole system is being set up to fail. Please don't think this is just about veterans. When VA hospitals can't treat their patients, those veterans spill into your community hospitals and ERs. More patients, longer waits, worse care for everyone. And here's where things take a super shady turn towards Project 2025. The Trump admin just terminated nearly every union contract of the VA, except for law enforcement. Nurses, gone. Doctors, gone. But the cops, still a union. That's not an oversight. I believe we say it's a feature, not a bug. They strip organizing rights from people who keep patients alive, but protect the same rights for the people with badges and guns. That fits the authoritarian playbook of weakening care and strengthening control at the same time. And while they're at it, they're slashing hiring bonuses, pushing patients into private care, and calling it reform. Here's what that really means. Instead of funding VA hospitals directly, your tax dollars are going to private companies with higher profit margins, less regulation, and executives that demand cartoonish pay packages. That's what veterans mean when we say privatization. They're going to break the system until we beg them to sell it off. Like everything else this admin is doing, it won't stop with veterans. When the VA model collapses, it takes the single-payer healthcare idea down with it. Your hospital bills will just keep on going up. If you're still here listening, you probably want to do something about it. The easiest step is to like and follow along. It costs you nothing. Shares and comments help this message break through the algorithm and reach the people who might need to know. You can always call the Congressional switchboard, 202-224-3121. Tell them you support the right to organize for all workers, not just cops. Whatever you do, remember to close the app for a few minutes. Go touch some grass, pet a dog. See if you can't find yourself on that Life of a Showgirl pre-sale list. Take care of yourself so you can keep showing up. Thanks for listening.